Disclaimer: this podcast is for educational and informational purposes only. It is not medical advice. Always consult a qualified healthcare provider before starting, stopping, or combining any medication, supplement, or peptide. Individual results may vary, and safety and effectiveness can differ depending on personal health conditions. Now, let's get started. When we talk about next-generation weight loss medications, one of the most exciting names that comes up is Retatrutide. Retatrutide is an investigational peptide-based therapy developed to target multiple pathways of metabolism. You may already be familiar with semaglutide, tirzepatide, and other GLP-1 receptor agonists. Retatrutide goes even further because it's not just a GLP-1 agonist. It also activates GIP receptors and glucagon receptors, making it a triple agonist. This combination approach is designed to increase satiety, reduce food intake, boost energy expenditure, and promote fat loss more efficiently than current medications on the market. Let's break that down a little more. GLP-1 receptor activity primarily helps slow gastric emptying, reduce appetite, and improve insulin sensitivity. GIP receptor activation may enhance insulin secretion and further support blood sugar control. Glucagon receptor activity has historically been a challenge because glucagon raises blood sugar, but in the context of this triple agonist, glucagon receptor activity appears to boost energy expenditure and support fat burning. Together, these three mechanisms form a powerful synergy. Clinical trials so far have shown promising results. In a Phase 2 study, patients receiving Retatrutide experienced dramatic weight loss, in some cases over 20% of their body weight within 48 weeks. That level of weight reduction is close to what we see with bariatric surgery, but without the invasiveness of an operation. Beyond weight loss, participants also showed improvements in cholesterol, blood pressure, liver fat reduction, and markers of metabolic syndrome. The unique aspect of Retatrutide is how aggressively it pushes the boundaries of obesity management. Current GLP-1 or GLP-1 plus GIP therapies are already impressive, but adding glucagon receptor activity might make Retatrutide one of the most effective metabolic drugs ever studied. However, this potency comes with side effects that need careful consideration. Common side effects include nausea, vomiting, diarrhea, and constipation, similar to other incretin-based therapies. Because Retatrutide is more powerful, these side effects can sometimes be more intense, especially early in treatment. Dose titration, or gradually increasing the dose, is used to improve tolerability. Other potential side effects being monitored include increases in heart rate, gallbladder issues, pancreatitis, and rare gastrointestinal complications. Researchers are also monitoring lean muscle mass preservation, since rapid weight loss can sometimes lead to unwanted loss of muscle tissue. In addition to weight management, Retatrutide is being explored for type 2 diabetes, fatty liver disease, and even cardiovascular protection. Many patients living with obesity also struggle with insulin resistance and fatty liver, so a therapy that addresses all these areas at once could be revolutionary. Now let's zoom out and look at the bigger picture. The obesity epidemic has been growing for decades. Lifestyle interventions like diet and exercise are foundational, but they're not enough for everyone, especially those with severe obesity or metabolic disorders. Medications like semaglutide, Tirzepatide, and now Retatrutide represent a new era where pharmacology can significantly alter the trajectory of chronic disease. This is not about vanity weight loss. It's about preventing heart attacks, strokes, diabetes complications, and improving quality of life. That said, no medication is a magic bullet. Even with Retatrutide, lifestyle remains essential. A balanced diet, physical activity, and stress management are still key. What the medication does is give the body a powerful push in the right direction, making those lifestyle changes more sustainable and more rewarding. Patients often report that their cravings decrease, their appetite feels manageable, and their energy improves, which allows them to stay more consistent with exercise and nutrition. There's also an important conversation to be had about access and cost. These new therapies are often very expensive, and insurance coverage is inconsistent. Without coverage, monthly costs can be out of reach for most people. This raises ethical and public health questions about how to ensure treatments that could save millions of lives are available to those who need them most. Another area of ongoing research is combination therapy. Scientists are already asking whether Retatrutide could be combined with other peptides or drugs to enhance outcomes further. Could it be paired with amylin analogs? Could it be stacked with lifestyle interventions like intermittent fasting? Could it one day be used with stem cell or regenerative medicine approaches? The field is wide open, and we're just scratching the surface. Let's take a moment to consider the future. If Retatrutide or drugs like it continue to perform as they have in trials, we may be looking at a major shift in how obesity and metabolic disease are treated globally. We could see fewer cases of type 2 diabetes, fewer heart attacks, fewer joint replacements, and longer, healthier lives. This could also reduce healthcare costs in the long run, though the upfront expense of these drugs will remain a challenge. It's worth remembering that peptides like Retatrutide are not just about weight loss. They're about metabolic rebalancing. They help the body process nutrients more effectively, regulate energy storage and expenditure, and create a healthier internal environment. This is why patients often report improvements in sleep, energy, inflammation, and mental clarity, even before massive weight loss occurs. Of course, all of this comes with a big caveat. Retatrutide is still under investigation. It is not yet widely approved for public use. The data we have is promising, but larger and longer studies are needed to fully understand the benefits and risks. We must also remain cautious about long-term side effects that might not appear until years down the road. So, what should you take away from this discussion? First, Retatrutide is a groundbreaking peptide therapy that acts as a triple agonist, targeting GLP-1, GP, and glucagon receptors. Second, the weight loss and metabolic improvements seen so far are unprecedented in drug therapy. Third, while it looks promising, it is not a miracle cure and comes with side effects and accessibility issues. And finally, as with all therapies, it should be seen as one tool in a comprehensive approach to health that includes nutrition, exercise, and individualized care. If you're someone considering peptide therapy or struggling with obesity, keep an eye on Retatrutide as it moves through clinical trials. Ask questions. Stay informed. Work with healthcare providers who are up to date on the latest science. And remember that your health journey is unique. There is no one-size-fits-all approach, and what works for one person may not work for another. Disclaimer: This podcast is for educational and informational purposes only. It is not medical advice. Always consult a qualified healthcare provider before starting, stopping, or combining any medication, supplement, or peptide. Thanks for listening. Keep learning and stay curious.